Hello and welcome to our Gold viewers. I'm Fiona Lang Sharp, IBCLC Public Relations Manager and MC for the Gold Perinatal Online Conference 2015. Welcome to my interview with Dr. Cheryl Scott. Welcome, Cheryl. It's great to have you here.
Thank you so much.
Well, I'm very excited because I know what you're talking on, but let me tell our listening audience implementing skin to skin in the hospital. Oh my. And I just love that. When I saw that title, it just makes me smile, Cheryl, because I know your heart in this situation and about skin to skin. So, very excited to hear more about what you have to teach us and what you've learned over the years in your profession. So, you and I have been chatting a little bit already today, but I want to know a little bit more. So, Cheryl, I consider skin to skin a foundational part of our healthcare in the maternal child field, but why do you feel we need to discuss this?
Thank you, Fiona. I'm very, very strong on this subject. I've had about 30, almost 35 years now in this field as a nurse, as a lactation consultant, as well as in the research area. And I have found that the implementation of early skin to skin, the moments right after birth, and the continuity of skin to skin for several hours a day for the first 3 to 4 months, this is what really makes it or breaks it for breastfeeding as well as for parental infant bonding.
That's so lovely, Cheryl. There's just so much to be said about this, and I so appreciate, just at the tip of the iceberg, giving us just a little bit. So, is there more we can learn about skin to skin and the role it plays in the big picture of the mother and baby?
Yes, there is so much we are going to be learning about, and I encourage as many people who can tune in to be able to learn. This is very transformative. We're going to be learning how we can be empowering our parents and our baby through the various practices we have in the hospital and even in the home environment on how to obtain the skin to skin practice so that it's easy for the mom and our babies to achieve this. As a nurse, our nurses are going to find how their role will be greatly maximized and how their role at work will be easier, because when we simply get moms and babies together where they are biologically entrained, neurologically entrained, babies can actually latch much better. Moms make the milk usually in an abundance. We just have to get moms and babies connected, and that's what we're going to be learning.
Well, I'm certainly very excited to hear about that. And, it just amazes me that over the years that I too have been practicing, that there just is always more to talk about in this foundational part of our care. And so I'm encouraging everyone that's listening to come to this talk because I know that, you know, Cheryl and I and all of our listening audience, we can keep this conversation going. And even if we feel like we know enough, I know there's always more to learn, and we can continue sharing it with our peers in the field. So, lastly, Cheryl, can you tell me what are you most excited about sharing with our delegates? Now, don't give us too much, but just tell us enough because I want everyone to come and listen to you.
Thank you. Well, I'm really excited. It's a twofold thing. People who have heard me know that I'm very pragmatic. I speak only on what is going to change our care. And so I'm going to be focusing on a lot of the practicality of this. And that makes our role much better as a nurse, as a lactation consultant, but it really harmonizes the mother and the baby. So we're going to be learning about the simple ways of enhancing this. But what I'm really excited about is bringing in the research about the amazing effects of the heart, the father's heart, the mother's heart, integrating with the electro and magnetic frequencies of the baby's heart, and how that just transforms these individuals, mother, baby, father, into a beautiful family. And so I really can't wait to bring this information to our listening audience.
Oh, well, thank you so much. That is just lovely. I'm feeling that sense that it's such a strong pull, you know. I can hear your heart expressing all these things, but I know that you've put so much research into this, Cheryl, and you have so much experience. So I'm looking forward to you sharing more with me and, of course, our listening audience. Thank you for taking the time to sit down with us today. It was lovely having you.
Thank you so much. I look forward to our time together.
And thank you to our listening audience listening in. Everyone out there, have a wonderful rest of your day. And I've been sitting down with Dr. Cheryl Scott, and she's going to be sharing her presentation at Gold here, implementing skin to skin in the hospital. Oh my. Thanks again, everyone, and have a great day.